Hi, my name is Morgan Matuzzi. I'm 27 years old and this is my story to fighting thyroid cancer.
There's so many things that I wanna tell you. There's so many things that I cannot share with you, I don't want you to leave my shadow. It's what I'm going through, I cannot share with you.
I was diagnosed with medullary thyroid cancer about 4 years ago. While I was studying music production and songwriting and singing in Berlin. I had been having a lot of symptoms for actually years. I was having chronic tonsillitis, I always had low-grade fever, and I kept on going to the doctor and tell them that I felt something was wrong with me, something was wrong with my hormonal system or whatever. And they kept on running tests and no one was finding anything, which was really frustrating, to the point I thought I was just hypochondriac. But one day, while I was studying in Berlin, I went to an HNO. I went to the ultrasound. They told me I had a tiny nodule on my thyroid. And I instantly started to cry because, I don't know, intuitively I felt something was wrong with me and I could feel it was serious, and the lady instantly reassured me and she told me, no, don't worry, it's very, very common to have nodules on your thyroid. Just take an appointment with an endocrinologist and, so they can check it out. 6 months later, I go to the appointment with the endocrinologist in Berlin and I tell her about all my symptoms. She looks at the nodule and she was like, okay, it doesn't look that bad. It seems pretty okay to me. And I remember I was like leaving the room and she told me, Miss Matuzzi, please wait. Actually, I changed my mind. There's one last thing I want to check. The way the diagnosis was communicated to me was horrible, to be honest. She started telling me, yeah, your test result came back and your CEA and calcitonin, and I just stopped her. I was like, I just don't know what CEA and calcitonin are. I have no idea what they are. Now I know that they are tumor markers. And I just asked her, do I have cancer? And she was like, I'm so sorry, but I think so. I think you do have cancer. And then my second question was, because I am a professional singer, I asked, will my voice be okay? And she told me, yes, most likely. So I had to find a surgeon, and I was told that in Geneva, Frédéric Triponnet was absolutely amazing, and that we are specialized in thyroid. The next day or 2 days later, I had a video chat with him where he explained me everything. He was absolutely adorable. He was really reassuring. I was extremely worried about my voice. He really reassured me, told me about, all the medical techniques and medical instruments you have now to monitor the nerve. I think 3 weeks later, I was in for surgery.
When I met Morgan, I first saw a young woman who was, of course, stressed about the diagnosis first, because it was an oncologic diagnosis with a potential implication for the rest of her life. And second, because she was already a professional singer, so also a lot of stress regarding the potential complication of the surgery. So the good thing is that Morgan was sent by an endocrinologist, so she quite knew about the diagnosis already. So she already had the time to make the effort to understand the oncological diagnosis and the implication of the cancer. And so I could concentrate more on the surgical part, including the potential complication, of course, and the potential implication of that complication of her life, quality of life, and life as a professional singer.
So he told me that with this kind of thyroid cancer, we have to be pretty aggressive with the surgery. They had to remove, in my case, the central compartment, which was anyway going to happen, but also on the left side. and they removed 20 lymph nodes, and out of the 20, 16 had cancer.
During the surgery, it was a little bit challenging because of the cancer, because of the need for neck dissection, lateral and central neck dissection, which of course increases the risk for the recurrent laryngeal nerve first, and also for the parathyroid preservation, because when you do a central neck dissection, the parathyroid are more at risk to be devascularized or even removed and need to be re-implanted. And of course for a professional singer, but also for a regular patient, but you should be most careful about the external branch of the superior laryngeal nerve. That is very important for a soprano singer like she is.
When my surgery was done, I had to stay at the hospital for 2 days. Frédéric Triponet, my surgeon, came after the surgery, and he said that my prognosis was really good, the surgery went really well, that I shouldn't have any issues with my voice. And yeah, he didn't lie. It's been 4 years and it's going really well.
It's standardized treatment which leads to extremely good long-term results, even in very young patients, even in children, or in patients like Morgan, who actually has an excellent result, oncologic results.
After the surgery, my voice did change. My voice has changed, I would say, but in a positive way, because I had so many cancerous lymph nodes. It was kind of always tense in that area, and now I feel really free. I feel that, yeah, it's much easier to sing. But it took about 3 weeks until I could do my first recording job for a client. I did make a video where I talked about my journey with, it was more based on the vocal recovery, because prior to the surgery, I didn't find anything that was really reassuring on YouTube or on the internet.
Oh, I think it's very valuable that Morgan shared her experience with other patients, because many patients ask about the voice, and of course we tell them that there is some recovery part, and of course that they will not be able to sing particularly as high pitched just after the surgery, even if everything was okay, because you have some inflammation on the vocal cords because of the intubation tube, and around, particularly on the small muscles that make the vocal cord move. So they need some recovery time to get back their whole range of voice.
So if I had any advice to give to people in general, is that they shouldn't ignore lumps that they feel anywhere in their body, and you should always advocate for yourself. If I had been told 4 years ago, you're going to have a cancerous lymph node, but you're going to be able to not think about it every day and just live your life, I would have been like, what are you talking about? This is impossible.